Hey everybody, it's Chris from Chris Beat Cancer, and today my guest is Dr. Izabella Wentz, the thyroid pharmacist. She is a pharmacist who has dedicated herself to addressing the root causes of autoimmune thyroid disease after being diagnosed with Hashimoto's thyroiditis in 2009. And she is a New York Times bestseller. Her patient guide is called Hashimoto's Thyroiditis, Lifestyle Interventions for Finding and Treating the Root Cause. And she is an ardent champion of incorporating lifestyle change and functional medicine into the treatment of autoimmune disease. So functional medicine is so key, and I think it's the future of medicine right now, is figuring out the causes of our diseases, which thyroid disease is a Western disease, as is most cancers, heart disease, diabetes, Crohn's, etc. So Izabella and I met at a conference. In fact, I met her and her husband, Michael, and I just thought, these people are great. I love what she's doing. Thought it'd be fun to have her on the podcast. And obviously, some of you may be watching this on YouTube. So anyway, I'm going to stop talking and say hi to Izabella.
Hey, Chris, it's so good to be here. Thank you so much for having me. I love the work that you're doing.
Thank you. Yeah. Well, it's great. We're in Mutual Admiration Society. That's a good thing. So why don't we start with your story? Because you're a conventionally trained pharmacist, right?
Absolutely.
And you started working in a pharmacy?
So, I went to pharmacy school. I started working at a pharmacy when I was 16, and I knew that I wanted to help people. And I was really interested in chemistry and how different substances affected the human body. And I ended up getting a doctorate degree in pharmacy. But to get from basically high school to pharmacy school and finishing pharmacy school was a really tough journey for me. During my freshman year of college and undergrad, I ended up, coming down with a weird viral sickness and then just never fully recovered. So I went from being this bright-eyed and bushy-tailed kid, kind of like jumping out of bed with a ton of energy, going to exercise, going to all my classes and doing extracurricular activities, to being basically a sloth. I would sleep for 12 to 14 hours each night. I'd be dragging throughout the day. I once missed a final exam because I slept through it. I had laid down the night before to basically take a little nap at like 3 p.m. so that I could study a little bit more. And I ended up sleeping throughout the whole night and missed my 8 a.m. exam. And so it was just this strange thing that happened to me. And I learned that I had been exposed to the Epstein-Barr virus, which a lot of people get and a lot of people do okay with, especially if they're younger. But because I was exposed in college and there were some other things going on in my life, my body just was not able to suppress this virus. And I just had this chronic state where I was just exhausted. And this continued on even during pharmacy school. Then eventually I ended up with irritable bowel syndrome, and then I ended up with all of these weird symptoms when I finished pharmacy school. So I thought I was doing everything well. I was a good student. I went to all my classes and they said, don't smoke, don't drink, exercise, eat low fat. And I was like, okay, I'm doing all of this. I'm doing whole grains. I'm doing low fat. And I ended up just feeling horrible all the time. I was sleeping for 12 hours a night. I was losing my hair, having panic attacks, irritable bowel syndrome, acid reflux, carpal tunnel in both of my arms, where I had to wear like casts on both of my arms. I was always bloated and just, not really the person I imagined myself to be. I always thought I would be kind of like taking charge of the world and helping people, saving lives. That's what I really wanted to do. That's why I went into healthcare. And I ended up just being this super tired person that just went to work, came back home, had dinner, sat in front of the TV and went to bed. And that was my life. For most of my 20s, I was just too tired to do anything else.
Now, how did you find out about the Epstein-Barr?
How did I find out? It was kind of one of those weird things where I just nobody knew why I was so tired. And my mom actually pursued some testing for me, and they found, they couldn't find anything, but they said, you recently had an Epstein-Barr virus infection. That is, that could have triggered your fatigue, and eventually, hopefully you'll get better. And unfortunately, there was a connection between chronic fatigue syndrome and Epstein-Barr virus. And part of me was like, okay, well, this is something that can't be cured. I saw, multiple doctors, and they offered me like stimulant medications, antidepressant medications, and just a lot of interesting stuff. that
Remind me to say something about that antidepressants, but continue.
yeah, stimulant medications, antidepressant medications. I was offered all kinds of things, told that it was in my head, that I was getting older, that everybody's tired, and all of these things were happening. And, mind you, Chris, I was like 25 then when all this was happening, and I was trying
And
to seek out
still
answers.
had no real answers.
I didn't. And I had my thyroid tested, and my doctor, I actually have this test from this doctor that said, okay, your thyroid is normal. Looking back at this test now and being, more of a patient advocate and understanding how the testing looks, I definitely had, I'm not surprised why I was a sloth at that point because my thyroid was not normal. And so eventually when I was,
What do you remember what it was? Like what your numbers were?
yeah, so it was TSH and my
Mm-hmm.
numbers were 4.5.
Okay. Which isn't crazy high.
It's not crazy high if you're a woman in your 90s,
Yeah,
but when you're
yeah.
a 25-year-old woman, your TSH should be somewhere right around 1.
Yeah, yeah.
And most of my clients and most of my, readers will say that they feel best somewhere between zero point 0.5 and 2.
Mm-hmm.
And I would venture to say that, the younger the woman, the closer to that 1 she's gonna need to feel her best. And of course, everybody's a little bit different, but anything above a 2.5 should be considered suspect of thyroid disease,
Mm-hmm.
underactive thyroid. And at the time when I was getting my test done, the reference ranges were not up to date. So
Okay.
reference ranges are basically what they do is they take a bunch of people's blood and they say, okay, well, these are the standard deviations for all these people in the blood. So if you're above this, then you're abnormal. If you're below this, you're abnormal. What they didn't account for is that they had people with thyroid disease in that pool of blood. As you said, it's
Sure.
a very common condition.
It's funny to me, and I read an amazing article, and I don't remember, it was in a medical journal, but the physician that wrote it was talking about how the fact is when you have a sick population, then all the reference ranges are going to be way off. So what they consider normal for an American, whether it's their cholesterol level or their thyroid hormone or whatever, is based on all of these quote unquote normal Americans who are sick and unhealthy. So anyway,
And so they were having this huge reference range and saying, okay, you were normal, you're normal. And yet, I was like sleeping under 2 blankets in Southern California, like in the middle of the summer. I was like
mm,
walking around the house in sweatshirts and my husband was in shorts, which for people listening, that's a good indication that you may have a thyroid problem, the cold intolerance. And so, yeah, I just had struggled with all these symptoms. And finally, I had been a pharmacist then for a couple of years. And I realized that not all doctors were created equally. I didn't, for some reason, when I was going through school and undergrad, and I know a lot of people think like if somebody has a medical degree, then they know everything. And,
sure.
it was one of those things I learned that that wasn't the case. So I sought after, I looked out for doctors that I knew would be more comprehensive and were highly recommended by some of my peers. And I ended up finding a doctor who figured out that I had Hashimoto's and an underactive thyroid, which was responsible for quite a few of my symptoms, and not for all of them. But that's kind of how I found out. I was 27 at the time, and thought my life was going to end. I was worried about. I had just gotten married, and I was worried about if I would ever be able to have children. My hair. I was losing so much hair. I was telling my husband Michael, like, I'm gonna be bald. Are you still gonna love me?
And he was like, no.
Actually, Michael's really sweet, and he was like, "Of course, I'll still love you." And I'm like, "But what about everybody else? They're gonna think I'm weird." And so,
No, that's traumatic.
yeah, it was
I mean,
traumatic.
I would be like really unhappy if my hair just started falling out, you know? Yeah.
Yeah, and it seems very vain, but for a lot of women, it's a constant reminder of something is off. So,
Yeah.
you may not look sick, and you feel it on the inside when you have an autoimmune condition, and people will say, "Oh, but you look great. You look great." But when every time you brush your hair, you have like a little rat in your hairbrush. It's a constant reminder that something is off about your body, and
Hmm.
hair loss is one of those subtle signs that our body's trying to tell us something.
Would you mind mentioning some of the other like warning signs since we're on that?
Absolutely. So,
Obviously, feeling like crap.
feeling like crap. So, there was a study done in people with thyroid disease, and it looked at like basically their quality of life. And one of the biggest things that people reported is basically just they can't quite put their finger on it, but they just don't feel well. And it's just like
Yeah.
and they feel guilty that they're one of the biggest symptoms is fatigue. So majority of people with the thyroid condition will have very severe and debilitating fatigue, and it's to the point where, for me, I was sleeping for 12 hours to get out of bed, to be able to like function. I had to sleep for 12 hours, and then I'd be tired throughout the day, and it was just like dragging myself along. So loss of ambition. I had always been like super ambitious and type A. And then all of a sudden I just like didn't care about like anything. It just was like, okay, I just want to get through my day and watch a little TV and that's it. And then guilt. So a lot of people will feel guilty because they'll be like, okay, I should be doing more. I should be, why am I so tired all the time? Why am I so lazy? And then they have fatigue is the big one, like I said. And then they have cold intolerance, where all of a sudden, if you're the woman in your office that's wearing a jacket and a sweater and a scarf when everybody's in a t-shirt, that would be a good indication of that. People have trouble losing weight, or they will put on more weight. So even like eating the same diet, same amount of exercise, and this happened to me. I'm like really short and petite, but I was like, my sweatpants were starting to get tight. And I'm like, I'm not doing anything differently, but like all of a sudden I can't even put on my sweatpants. All their symptoms are going to be hair loss. So I probably lost like a third to half of my hair.
Wow. Yeah, that's a lot.
It's hair loss from everywhere. So it's not like you have bald spots, but they'll be coming from everywhere. And all of a sudden your hair starts looking dull, your skin starts looking dull. You also end up with a lot of symptoms, mental health symptoms. So I had panic attacks. Some people might have depression. Some people might have anxiety. I've even seen people who were misdiagnosed with bipolar disorder and even hospitalized for psychotic disorders because of their thyroid.
So it definitely can affect your mood and your brain chemistry, right? Depression, anxiety.
Yes, and I would say that for every single person who's been newly diagnosed or even just a long-standing history of quote-unquote mental illness, that their thyroid function be checked, because it's such a big symptom. And, sometimes reversing the thyroid condition can actually reverse the mental health diagnosis. And then you don't have to get stuck on antidepressants and antipsychotic meds, which we know have, as a pharmacist, they're some of my least favorite medications.
I'm so glad you brought me right back to what I wanted to say earlier. That was perfect. You don't even realize you did it, I don't think. But so the 10th most prescribed drug, and I just posted this on my Facebook page. Here's a pop quiz for you. And if you don't know it, it's okay, but I'm just curious. What is the 10th most prescribed drug?
I'm going to guess that it's an antidepressant or an antipsychotic. The number one prescribed drug is actually Synthroid, so synthetic thyroid hormone.
So you're right. The 10th most prescribed drug is Abilify, which is an antipsychotic. And this year, over 8 million prescriptions have been written for Abilify, which I posted this on my Facebook page a couple days ago, so it's fresh in my mind. But that kind of freaks me out, that there's millions of people walking around on antipsychotic medication. You know what I'm saying?
Absolutely.
And most of them probably do not need it. Not to say they're all psychos, but you know what I mean? But, you had a thyroid problem and they're trying to put you on an antidepressant.
Yeah, they were trying to put me on antidepressants. And at the time, so when, and I remember, Chris, when Abilify, because I was working as a consultant pharmacist in a mental health setting, and people with a lot of multiple medications and multiple health conditions, and some of them had mental health issues. And so I was working very closely with people who were on antipsychotic drugs. At the time, antipsychotic drugs were not approved for the use in depression, but they kind of started getting this approval. And I just remember thinking, oh my goodness, because the side effects that we saw with our patients on antipsychotic drugs, like you would have a person who was my weight, and within a year of starting on, Zyprexa, which is another antipsychotic med, they would be obese. And you would have with their cholesterol levels, they'd have like new onset diabetes. There's all kinds of things like there's something called tardive dyskinesia, where people basically end up with just these very, very uncomfortable kinds of facial tics, and sometimes their bodies get stuck and contractures, and it just was devastating to see some of the patients on these medications. Sometimes people would be basically put in like a zombie-like state because they'd be so sedated by them. And and yeah, like one of my main jobs was to actually monitor the use of antipsychotic medications for our patient population. And my biggest recommendation was like reduce the dose or
Yeah.
take them down or get off of this medication because people, were having such devastating effects. And so, of course, I was like, when my doctor said, "Oh, you're having panic attacks and you're tired, let's put you on antidepressants and let's put you on anxiety medications," I was kind of like, okay, but I think there's something else going on. Like, I don't think this is not me. Like, there's something else happening. And so, while some of those medications can help people, and I will never say that nobody should ever be on those medications, when you're trying to treat a thyroid problem with an antidepressant, which happens to a lot of my clients before they get misdiagnosed,
Yeah.
it's kind of like, okay, that you're not treating the root cause. You're not going after the condition. You're just throwing something at somebody and hoping that it sticks.
And you were an atypical patient, obviously, because you had this experience with Abilify and antipsychotics. So, but the average person walking in to their doctor's office, they're going to take whatever the doctor tells them. And I mean, my wife, she was prescribed Prozac for something that had nothing to do with Prozac like years ago, and
Yeah.
doesn't take it now. But it's same kind of situation where so many people now are basically prisoners of pharmaceutical drugs, and they're addicted to various drugs that are not healing their body. They're not fixing their problems. They're just mitigating symptoms to some degree, and again, not helping them get well. So, how did you figure out? And I'm sure it didn't happen overnight, but can you talk me through or take us through the process of your diagnosis and figuring out what you needed to change about your diet and lifestyle to get well?
Yeah, and it was a really long process. It went from, one of the bigger things for me is that I learned that I had an autoimmune condition. So I learned that my body was attacking my thyroid gland. And the doctor said, okay, so you can take a thyroid medication for this. And, thyroid medications, as maybe we'll talk about a little bit later, they're actually going to be the same hormone your body produces. So they're not like the dirty drugs like the antipsychotics or some of the antidepressants that just cause all kinds of issues. They're basically going to replace what your body should be making.
Mm-hmm.
And so, I didn't have a problem with the medications, but I was like, so you're telling me that my thyroid is being attacked and we're not going to do anything about the attack. We're just going to take more of the hormone, where it's kind of like, okay, so I have a boat. I'm in the middle of the ocean and there's a leak in my boat and you're giving me this little, bucket to dump out the water. Like, why not plug up the leak? So to me, that didn't make sense. When I was in pharmacy school, we always talked about lifestyle interventions for most chronic conditions. And so for like, maybe they weren't the most helpful ones, knowing what I know now. If somebody had hypertension, you would put them on a specific diet or diabetes and whatnot. And so I wanted to know if there was anything that I could have done to develop the condition, to prevent its progression, or even to, I was hoping I'd be able to like reverse it and put it into remission, which doctor said, no, there's no way you can reduce the autoimmune attack on your thyroid gland. You're kind of stuck with it. There's pretty much nothing you can do. Just wait for it to get worse, and then we'll test you for other autoimmune conditions. And I thought that was very disempowering.
Yeah, classic medical conversation.
Exactly. And, one of the scary things with Hashimoto's is that it's basically considered like a 5-stage condition. So in the first stage, you just have the genetic predisposition, and you're not going to have any symptoms, any change in thyroid function. And then these stages kind of progress. And, the third stage is basically when you start seeing changes in thyroid function. Whereas the 5th stage is like when you progress to another autoimmune condition. And it's kind of scary because you can get, there's other autoimmune conditions can be, not that Hashimoto's doesn't affect people in a profound way, but there's some that can put people in wheelchairs,
Like what, for example?
Like multiple sclerosis,
Yeah,
or lupus, or even rheumatoid arthritis. There's over 100 different autoimmune conditions. And when you have one, you're at risk for other ones. And so I wanted to figure out if there was anything I can do. At the time I was working with people with rare chronic health conditions that oftentimes they had like weird genetic conditions, and they had multiple disabilities and multiple medications and multiple health issues. So I was spending a lot of time like looking into PubMed and looking at like the rare disease associations and trying to figure out like what can we do for our clients to get them better, because there's not like a standard of care. It's not like, oh, you have high cholesterol, just, there wasn't a standard of care for these clients. So I decided to do the same for myself. And I came across a study that linked gluten to Hashimoto's, and that found that people who went on a gluten-free diet who had Hashimoto's and celiac disease, some of them were able to reverse their conditions and get rid of the thyroid antibodies, which mark the thyroid for destruction for the immune system, and normalize their thyroid function. And I was like, wow, really? Food can make a difference? And I was like, okay. And I started really digging deep into the research, and I came from a very skeptical scientist background. So it took me probably over a year to implement the changes from the time that I learned about them. And I just kind of started finding more and more information. And came January 2011, I began to start implementing it. And, I went gluten-free and dairy-free. And within 3 days, my like acid reflux that was keeping up my husband, Michael, up for 3 years, because I would like wake up coughing in the middle of the night. That went away within 3 days. IBS went away in a week. Carpal tunnel went away within a few more weeks. That took a little bit longer. And then my thyroid antibodies began to reduce, and I started to start feeling better. So that was one of my first steps into the world of, I guess, functional medicine. And ever since that, I haven't turned back, and I've done additional things to kind of improve my outcomes and improve my condition. And I'd like to say that it was as easy as just going gluten-free. For some people it is. For me, I had to kind of really dig and peel back the layers of all the imbalances that were going on in my body.
My wife had a thyroid problem, and her TSH was over 30. Like it was like, whoa. Yeah. And we were able to turn it around pretty quickly, but eliminated dairy. And it wasn't initially part of the protocol, but basically got away from dairy. Although she might have a little cheese every once in a while, but and we did the gluten thing, but for her it didn't make any difference. Which people are different. But found some very key nutraceutical supplementation that helped her a lot, and and it went back down to normal ranges in a couple months. So like, yeah, it really is great. I mean, just another testimonial that thyroid disease or thyroid disorders do not have to be, your doctor, if your doctor tells you like you're going to have this for the rest of your life, that may not be true, and it makes sense to change your diet. Like it makes sense to look, okay, what are the root causes, right?
Yeah, absolutely. And then diet is one of the very first things I recommend. And gluten is going to be the biggest thing. So I did a survey of my readers, and 88% of them found that going gluten-free was very helpful. The next biggest change was for your wife, and this was for me as well, was dairy. So 80% of people who went dairy-free found that it was helpful. For me, I believe that dairy is probably the bigger trigger as well. Of course, I was sensitive to both. Every now and then we'll see people who are just sensitive to one, but in some cases it may be multiple food sensitivities. Soy is the other big one that I recommend. So one of the things I'll recommend for people is going on a gluten-free, dairy-free, and soy-free diet for 3 months, and then take a selenium supplement as a starting point. And that can really make a dramatic difference in their antibody titers and their TSH levels and how they feel. And that's something, if you've been diagnosed with a thyroid condition, anybody that's listening, give yourself that 3 months to see if you can reverse it.
Yeah, it absolutely makes sense to do that. And, change your diet, change your lifestyle. Look at what you're doing. Something may be causing some problems, in wheat and dairy, gluten, obviously, and dairy are major agitators. You know what I think helped my wife a lot too, although I can't prove it, but I finally convinced her to stop drinking coffee, and I think it made a huge difference. I mean, she's been a lifelong coffee drinker, forever, and yeah, she just started feeling better, more energy, So have you heard that much?
Absolutely.
Any caffeine connection?
Absolutely. And people don't really like this because I'll tell them, you actually even tea sometimes, but definitely caffeine. So one of the big issues with thyroid conditions, and when we think about how a condition like that develops, we're thinking about generally it's a period of stress on the body that weakens our natural defenses. And when our natural defenses are weakened, usually it's going to be the gut that's affected. that leads a person to either develop a gut infection or to develop a food sensitivity. And then just kind of things get out of balance then. Once the gut is out of balance, then the immune system gets out of balance. Most of our immune cells develop and mature inside of the gut. So it's one of the three-legged stool of autoimmunity is basically having the genetic predisposition, the triggers, and then intestinal permeability or leaky gut. Mm-hmm. And so long story short, caffeine basically pushes our body and pushes our stress levels up. So, when you think about a day that why do you have caffeine? It's because you're tired and you're trying, you're basically taking in caffeine, you're trying to push your body further than it wants to go. And that's going to put you in a chronic stress state, which weakens your whole body. There's something that's known as adrenal dysfunction or adrenal fatigue.
Yeah.
And caffeine is one of the biggest contributors to that. Like I've brought myself in and out of adrenal fatigue just with, my caffeine use. And that's something that a lot of people will be very sensitive to. And in working with my clients who are who more or less don't get better on diet, one of the bigger things we'll look at is their adrenal function. And 90% of them will have adrenal function that's compromised. And sleep deprivation, excess caffeine intake, blood sugar imbalances, so having too many sugary foods is going to contribute, as well as, stress that you put, like mental stress on yourself, and then different types of, sources of hidden inflammation, whether they're foods or infectious in origin. Those would be what sets off the adrenals. And this is such a big connection in the thyroid, and just having your adrenals out of whack can cause you to have your TSH to go up and can cause more of an immune system attack on the thyroid, as well as many of the symptoms that we would normally attribute to the thyroid gland.
Yeah, and a lot of people are living in this constant state of chronic stress, and it's like a vicious cycle where they're stressed, so they're coping with stress with junk food and sugary food and caffeine, and then the caffeine is affecting their sleep, so they're not getting good sleep, and then they wake up and they need the caffeine to get going, and they're drinking it throughout the day to keep going. They're not eating well, and it's just day after day after day, and eventually it's like you're walking on thinner and thinner ice, and you're sort of teetering on the brink of disease, and eventually there's a tipping point where it's like something, the last straw, breaks, and then they have Hashimoto's, or they have cancer, or they have diabetes, right? Or they have Crohn's or whatever. And it's hard for people to break that cycle because, the first thing, and I love everything you said, because I feel like knowing is half the battle, reference an old G.I. Joe TV show, but once you start to become aware of your habits and your choices, then you can, if you can take a step back and look at how you're living your life and your day-to-day routine, and sort of admit that you might be causing some of your own problems. That's like the first step to recovery. I mean, whether an alcoholic or a drug addict or anything, you kind of have to admit like, hey, this might be my fault, right?
Absolutely. And sleep deprivation or being a perfectionist or putting too much stress on yourself, that's going to be a really, really big trigger for people, for any kind of chronic condition. And your genes are going to determine what you get. If you're genetically predisposed for one autoimmune condition, that's what you'll get, right? If your genes are predisposing you to heart disease or cancer, that's what you'll end up with. But, sleep deprivation is going to be pretty much bad for everybody. And I used to be the person that said, oh no, I can drink tea at bedtime with caffeine and I have no trouble falling asleep. But the way that I slept was like if a pin dropped in the room, I'd like wake up startled.
Oh yeah.
So I was not really fully sleeping. And they've done studies in people with sleep apnea. So sleep apnea is basically when you stop breathing throughout the night and you end up like waking up, but you're not fully aware that you've woken up. You just wake up for a split second and then you go back to sleep, but it takes you out of the, regenerative. Okay, I'm just going to give up.
Yeah.
It takes you out of the
regenerative
that helps you regenerate, right?
Yeah.
And so they found that people with sleep apnea, the longer they had it, the more likely they were to develop thyroid antibodies. And so that's such an important thing to make sure that you're off of the caffeine and that you're also not stressing yourself out. There was we've got over like 1,000 reviews on the book on Amazon, but there was one review that really stuck out to me, and it was somebody that left a 3-star review, and they said, I read this whole book, and all I really had to do was get rid of my stress. And then my condition went away. And so sometimes just getting rid of stress in your life, whether that's through sleep deprivation or, traffic or having a horrible job, that can be the big difference in
Yeah,
terms
or bad relationships.
of bad relationships.
Yeah.
Not a lot of people talk about that. But yeah, I mean, there is a post the other day that I saw on Facebook, and it said, we found that reducing inflammatory foods can make a big difference in one's health. Same goes for inflammatory people. Isn't that brilliant?
Oh, I love it. I talk to cancer patients every day, coaching them, and chronic stress is always a factor. I mean, it's a huge factor with cancer patients, and many of them have lived in a very high stress, lived a high stress lifestyle for years, and they've had work stress, people problems, relationship problems, financial stress, and oftentimes there are some very significant catastrophic and or traumatic events that happen in their life that lead right up to the diagnosis. That would be like the tipping point. So the loss of a loved one, a bad breakup, getting fired, getting divorced, even moving or having a baby. Like, they're already super stressed, and then those are like stress bombs. And the body's just like, I can't take it anymore, and then they have a lump or a bump or a tumor or a lesion, or things start breaking down. And I'm so glad you brought that up, because the stress component, and I've seen cancer patients, by the way, who did everything right. They did the diet, the supplements, they did all these really good things that to help their body. They did all the physical stuff, but they didn't address their stress. And they didn't forgive. They were holding on to all this anger and bitterness and all these really negative emotions, including guilt and shame, and they didn't get well. They didn't get well because they wouldn't let go of all the stuff. They were just like all the baggage.
I see the same thing in people with Hashimoto's. And when I first kind of, I'm just like this, I was this skeptical scientist, and I was like, well, I can measure, things like
Yeah.
supplements, and I can measure food, but I can't measure feelings, right? So
Can you measure my unforgiveness?
yeah, like how do you measure that with people? So I didn't really focus on that when I first started working with my clients, and then I found there were some people like that were doing all the right things, and I was like, I think they might have some emotional things, and it was kind of this elephant in the room, but I'm like, but you know what, I'm not a psychologist, I'm not going to go there with them. And those were the people that would continue to struggle. We'd work at, getting rid of one food, and then they become sensitive to other foods. We'd work on getting rid of one infection, and then they get another infection. It was just a constant cycle. And, eventually I came to the point where I was like, okay, I'm not a psychologist, but I think this is actually the big barrier in what's going on with you. So now whenever I work with my clients, or whenever I talk to somebody, the first thing I talk about is mindset. And, really looking at letting go your stress levels and really being kind to yourself, taking out, not tolerating anybody treating you like crap, especially yourself.
Yeah.
That's going to be one of the bigger things that can make or break a person.
I absolutely agree. I think stress accounts. This is a Chris Warkism, but I think I think stress accounts for at least 60% of health, because you can do everything else right, but stress will outweigh everything else you do. And heck, it might be 99%, but I feel like it's at least 60%, because it's enough to outweigh everything else.
Absolutely. Yeah, you can be on the best diet, you can be going to the gym and doing everything right, but if you don't have that stress component handled, if you're in a job that you hate or in a bad relationship, it's just going to drag you down.
It's true. So can you talk about some of obviously stress is a huge thing. Are there any other supplements or dietary components that you feel like people should know about?
So the most helpful diets that I found with my clients are going to be gluten-free, dairy-free, and soy-free diet. That's usually the starter diet for people. Some of the more advanced diets, if that diet, if they hit a plateau, would be doing something like the paleo diet or the autoimmune modified paleo diet, where they get rid of a lot of different proteins that they may react to. So they would get rid of eggs, nuts, nightshades, seeds, and they would do that, and all grains. They would do that for, a month time period and then reintroduce the foods back in, maybe one at a time for, every week to see which foods they're reactive to. And that can kind of start the healing of process of the gut. And so that's one of the things I recommend is just tailoring in your nutrition, making sure that you're eating a nutrient-dense diet, that you're balancing your blood sugar. So getting plenty of veggies, avocados, those things are great. So pretty much avoiding anything that comes in a package and shopping the perimeters, trying to eat mostly organic. That would be a first suggestion for people. The next thing I look at is nutrient depletions and nutrient deficiencies. And these are going to be very, very common in people with Hashimoto's. The most common one is going to be selenium. So taking selenium 200 micrograms per day in the methionine version has been found to reduce the attack on the thyroid gland. Usually you can measure these antibodies, and usually they reduce by about half in the course of 3 months. Lessens a lot of the anxious symptoms and a lot of the hair loss as well. Then looking at vitamin D levels. So vitamin D is something you can measure. A lot of times we'll see, we know that vitamin D helps us regulate our immune system, and we'll see vitamin D is oftentimes going to be depleted in people with thyroid conditions. Then also B levels. So vitamin B12 is very important. Thiamine, just a general B complex is going to be helpful. And then alkaline phosphatase, if that's low, that's an indication that somebody might have a zinc deficiency. And just kind of looking across the board, I'll do different types of assessments, and I have a lot of information on my blog with specific to the different types of nutrient depletions. But the most common ones I would say are going to be the selenium, vitamin D, B vitamins, as well as zinc.
So there's some controversy about the role of iodine in
very controversial.
The thyroid community, right?
Absolutely.
Can we talk about that?
Sure. Yeah, of course. It's always interesting because there's so many people that are very passionate on either side of the conversation.
Mm-hmm.
And there are people who have been helped by high dose iodine protocols, and they'll say, this saved my life. Why doesn't everybody do this? And then what the research has shown, and what I've unfortunately seen with my clients, is that in some cases, when you take iodine, especially in the high doses, that actually exacerbates the inflammation in the thyroid gland. So the way I like to think about it is, running is great for everybody, right? Everybody should go running, except if you have a broken leg, or if you have adrenal issues, or if you're in a wheelchair, then probably running is not going to be good for you. And so I would apply the same logic to iodine. So iodine needs to be processed by the thyroid gland to be used in the rest of the body. If your thyroid is inflamed and you're trying to get it to do more work, it's not going to be happy with you. And so there are multiple studies that have found the rates of Hashimoto's increasing in communities that just started adding iodine to the salt supply. So rates of Hashimoto's have doubled, tripled, sometimes quadrupled within a 10-year period. And, looking at the data with people with Hashimoto's, what's safe, what's not safe, they found that about 250 micrograms is going to be, or maybe 300 micrograms is going to be the cutoff safety. So if you take that much iodine per day, what's in a multivitamin is usually 150 micrograms, then you're going to be fine. But when you go above that, you have actually a higher rate of thyroid cell destruction. So your thyroid basically becomes more visible to the immune system, more inflamed, and you have more damage happening. And, I've seen people who were started on high dose iodine protocols, and they came to me with their TSH in the hundreds, with their T4 like really low, with their thyroid antibodies in, the 1,000 range, is very, very, very inflamed, very like bedridden. And then I've worked with them to say like, okay, well, let's get off of gluten, let's get rid of the iodine, let's try to get you on some selenium and do all these other things. And then we've seen a reduction in the thyroid antibodies to under 100. Their TSH would, normalize, and sometimes they'd have to get on medications for that. But yeah, so it's one of the things that I treat like a drug that can be very, very harmful if you're not using it correctly in the right person. I surveyed about 2,000 of my readers a few months ago, and I asked about these things. I asked like, okay, so what have you guys found to be helpful? And the gluten-free diet, 88% of people that tried it found it helpful, and like less than 1% of the people said it was harmful, right? And made them feel worse. With iodine, it was like 30% of people said it made them feel better, and then like 30% of the people said it made them feel worse. To me, that's too big of a risk to take
Hmm.
Like I wouldn't want to. I know there's so many other things that can actually help a person get into remission and normalize that I wouldn't necessarily. That wouldn't be my first recommendation for somebody is to take something that can potentially make them feel dramatically worse and increase their autoimmunity. So that's kind of where I stand on that.
Yeah.
I've had some people try to engage me in debates on it, and I wish it was that easy. I wish everybody can just take one supplement and get better, but the reality of it, it's usually multiple systems that are out of balance, and oftentimes you need to do a lot of different things to get the person in balance, and just blindly giving everybody the same thing can be problematic.
Yeah, and I think it is important to work with a practitioner, especially if you have something complex like Hashimoto's. And so, depending on who you're working with, they might, want you to take iodine, or they might not. But at the end of the day, like trial and error is going to be part of the process, right?
Yeah, absolutely. And some people with Hashimoto's will have an iodine deficiency. So you can actually, when you're working with a practitioner, you can actually test for that.
Yeah, I've done the 24-hour urine test.
Uh-huh.
Yeah, yeah, yeah. So
It's
I did it. I don't know, maybe a year or two ago. Just I was just reading iodine stuff, read some Brownstein's books and things, and was interested in it. And that was right around the time my wife was trying to get her thyroid
Yep.
figured out. And I was about, it was either 20 or 25% deficient in
Okay.
iodine. So I was like, that's interesting. I wasn't feeling bad. I was feeling fine, but that's what came back for me. So as a guy who's feeling good, you got to wonder, a lot of people are probably, and I know Brownstein had said, in his clinical practice, like 90 something percent of his patients were deficient.
Hmm.
So who knows? Yeah.
It's a very controversial issue, and I would say for most people without Hashimoto's, iodine is going to be very helpful. But with
Hmm.
Hashimoto's, it's like the thing that processes iodine is really inflamed,
It can
and so
exacerbate.
it can
Hmm.
exacerbate it. So we have to be very careful with it. And it's something that is definitely necessary for thyroid hormone production. So back in the day, most cases of hypothyroid were due to iodine deficiency.
Yeah.
So absolutely, if you have hypothyroid that is not Hashimoto's, then taking iodine is going to be the solution if you're iodine deficient. But it's to say, in Hashimoto's you can be deficient in 10 different things, and it's not always going to be iodine. In some
What's the
cases,
difference
with Hashimoto's
in
and
hypo?
so that's a really great question.
I know.
Hashimoto's
I'm
is
just kidding. I'm just kidding.
basically um, is basically an attack on the thyroid gland that results in hypothyroidism. So
Okay.
Dr. Hashimoto was a Japanese doctor working in Germany who identified some of his patients had immune cells in their thyroid gland, and these immune cells were causing destruction of the thyroid gland, which then results in an underactive thyroid. And so, underactive thyroid is basically a clinical state of hypothyroid where a person doesn't have enough thyroid in their body for whatever reason. And this can be due to Hashimoto's because the thyroid is under attack. This could be due to deficiency in iodine because iodine is necessary to make thyroid hormones. So, if you don't get enough iodine, then you're not going to make enough thyroid hormones. Pretty straightforward. And then there's also different types of, if you had a thyroidectomy, if you had some people were born without a thyroid, or there's different types of chemicals that can suppress thyroid function as well. So these are, multiple reasons why somebody would develop hypothyroidism. And I would say, looking at the research now, 90 to 97% of cases today of hypothyroid are going to be due to Hashimoto's. And I know
Wow, that many.
yeah, yeah. So that's what the research now is saying. And I know in Michigan, that was traditionally like a low iodine area. So I know that's where Dr. Brownstein practices. And
Yeah.
so that's, I actually am very looking forward to meeting him one of these days to ask him some questions. But looking at his work, my interpretation of it was he was looking at chronic infections in Hashimoto's, and he's also said, with Hashimoto's, you have to be very careful with iodine as well. So he does qualify that, and I know he does a lot of great work with, just in general.
Yeah, that's good to know. It's really good perspective. So, do you have any theories? Every time I turn around, somebody's got a thyroid problem. right?
Mm-hmm.
I mean, it's like rampant.
Yep.
What is causing this? Do you have any theories about this?
There's a lot of different theories out there, and one of the biggest ones is toxins. And so, toxins potentially in our environment, there are so many different chemicals that are unregulated and they're just, being used in everywhere, right? In personal care products, they're in our air, they're like in our homes. And that's been one of the discoveries with people who lived closer to like industrial plants and were exposed to different toxins, had higher levels of thyroid antibodies. So that would be my guess if I had to think of something is basically our toxic exposure
Yeah.
would be one of the bigger triggers for thyroid conditions. And there's been different biopsies of thyroid glands that have found like toxic chemicals in them, things like that.
Yeah, I know. From the research that I did, it seems like the three sort of main culprits would be chlorine, fluoride, and bromine.
Hmm.
But then I saw some other really interesting uh, research that was trying to make the connection between dental X-rays and thyroid disease because and what's funny is women are statistically women are much better about going to the dentist.
Hmm.
Like they just go to the dentist regularly, and men are like kind of bad about it. So there's an interesting correlation that obviously you can't prove it definitively, but this is radiation, and when you get dental X-rays, typically they're not protecting your neck. They might put the lead shield on your chest, but your neck is exposed. So I don't know. Any thoughts on that?
Yeah, absolutely. That's a really great thing that you brought up. So, radiation, even low levels of radiation, have been implicated in Hashimoto's, the thyroid autoimmunity, as well as asthma. And with going to the dentist, we are exposed to the X-rays. One of the things I always tell my clients and readers is to always ask for a thyroid shield, so you can actually, it's funny because they'll put this lead thing over your chest, and really, like the thyroid gland is right there, and that's what's going to
Yeah.
be the most sensitive to x-rays. And so, if you are going to your dentist and they are wanting to do that x-ray without a thyroid shield, just walk out. Fluoride used to be used, another thing is fluoride used to be used as a suppressant for people with an overactive thyroid back in the day before
Oh
they invented
wow.
medications for it. So now we have that in our water supply.
Yeah.
And
Not
so
mine.
this is, yeah, not
I
mine either.
filter it, but yeah.
Yeah, we do as well because of that, but and
Yeah.
other reasons. But they did a study in the UK that was published earlier this year, and they looked at in the UK, some communities fluoridate their water, others do not, and they were able to correlate the levels of fluoride in the water supply to the different health clinic centers throughout the UK, and they found that the people living in communities with high fluoride had more thyroid problems, and the people with
Yeah.
low fluoride or no fluoride had lower levels of thyroid problems, and hypothyroidism specifically is what they looked at. And so, yeah, so that's going to be a big contributor. Then we're looking
Of course,
at
chlorine is in the water too, which
exactly.
is
So we're
another halide, and your thyroid sucks it up.
exactly. So the halides basically can bind in the same spot in your thyroid gland that iodine normally would. And they can take up space there, and instead of creating thyroid hormones, they cause inflammation and damage to the thyroid gland. And there's different brominated compounds that are found in our mattresses, like basically
Mm-hmm.
so that smokers don't set themselves on fire. We have like
Flame
these
retardants.
and
Yeah.
those have been potentially can potentially contribute to increase in thyroid antibodies and getting into the thyroid gland. So I had one client who switched her mattress. So she got like an organic wool mattress
Mm-hmm.
that did not have those flame retardants. And she was like, all of a sudden my thyroid antibodies just started reducing. And so it was just that one change. And there's
That's amazing.
yeah, and I mean, we have so much crap in our makeup. So we have heavy metals in our makeup. We have personal care products. So women are constantly, slathering themselves with lotions and potions and things like that. And we'll see higher rates for every one man diagnosed with an autoimmune thyroid condition, there's going to be 7 women.
Hmm.
And so partially, estrogen could be
Yeah, the makeup connection and the dental visits.
dental visits, the makeup, definitely estrogen. So estrogen can
Yeah.
be on certain types of autoimmunity, and estrogen can increase our thyroid um, need. So whenever we have higher levels of estrogen, that then we have more need for thyroid in the body, and that can basically, in the presence of inflammation, when we have a big call to produce more thyroid hormone, that can actually, potentially attract some immune cells and trigger autoimmunity. So it's kind of all over the place. One of my kind of theories is basically when you think about the role of the thyroid, it controls our metabolism, and it controls our temperature, and it controls our fertility. And it's almost like it senses danger in our surrounding world. And so there was during the Irish potato famine, the women and people that survived were actually more likely to have hypothyroidism, because hypothyroidism made them not have to eat as much, and it helped them conserve energy. So,
Hmm.
kind of my theory is that it's almost like an evolutionary protective mechanism to sensing danger in our world. That if there's chemicals that are dangerous to us, if there's people in our lives, if we're under chronic stress, it's probably not the best time to reproduce. It's probably not the best time to go out and, be running around in the world. It's probably a good time to like be in your cave and sleep all day, right?
And store body fat.
And store
Because
body fat,
stress, yeah,
exactly.
if you're in the stress of, again, like you said, a famine,
Mhm.
then instinctively, or your body's wired to store more fat, for energy because you might run out of food soon. That's brilliant. I love it.
Yeah, so it's actually protective, and not that like we want that protection now. So it's kind of one of those
Especially if you're not in danger.
yeah, exactly,
Yeah.
exactly. Like we're not having bears chase us. We're not in a state of famine,
But
but
we're at that stress level though.
exactly. And the
Yeah.
stress itself could be contributing to us feeling like we're in danger.
We're living in that chronic, because your body doesn't know the difference when you're in chronic stress because you're in a terrible job or a bad relationship, or you're bitter. It's your body is reacting the same way it would be if you were literally afraid that your village was going to get attacked, or that you were going to run out of food, or whatever. It's the same stress hormones.
Absolutely. And it's just, adaptive physiology, and we have to understand, how to get ourselves in a state that is putting us at ease, and
Yeah.
it's making us happy, and doing things, we like our bodies are from, we're like cavemen and cavewomen living in modern times. Like we haven't evolved to be able to tolerate everything that's in our environment. We still have the same
Absolutely.
genes and same old protective mechanisms that may be a little bit outdated right now.
Yeah, and I don't see us catching up anytime soon. Like the only possible solution is that you have to, live as close to nature as possible, which is why I sleep in a treehouse. I'm just kidding.
I'm like, really,
Yeah,
dude?
yeah. Tell me more. Can I ask you one other thing? And I want to be mindful of your time, so just a couple other questions. But can you explain what hyperthyroid is, and maybe
Yes.
the causes of that? Just since we're talking about thyroid stuff.
Yeah, so hyperthyroid is an overactive thyroid gland. So basically, a person symptomatically may have weight loss, they might have anxiety, they might have palpitations, they might have tremors. They're also going to be having hair loss, and sometimes they'll also be tired, which is, not fair.
So similar symptoms in some cases.
Sometimes similar symptoms, but definitely like more irritability, more anxiety, palpitations, more sweating, more kind of like rapid weight loss where you're like, oh my goodness, this is happening way too fast. What's going on here? And it's a very, very distressful situation for the person. They feel just awful, like very irritable, very edgy. They often may also have a protrusion of their eyes. That's
Oh
a
yeah,
condition. And this
your
can be,
eyes bug out, sort of. Yeah,
yeah,
right, right.
can be very, very stressful for the person, and very, very difficult to deal with. And so this is something that's kind of the other pendulum, or on the other side of the thyroid dysfunction. But the underlying mechanisms are also going to be autoimmune in nature in most cases. So there's a condition that's known as Graves' disease.
Mm-hmm.
And basically, it's also an out of balance immune system. But instead of attacking, the thyroid enzymes and causing a destruction of thyroid cells. It attacks a certain part of the thyroid gland that's responsible for maintaining hormone levels. So then this part of the thyroid physiology basically goes unchecked, and just more and more hormones are produced.
So the thyroid's basically under attack, but it's like it's a different part of it that's under attack. Is that what you're saying?
Yep. So basically, the TSH receptor is going to be under attack. And then that receptor basically controls our production of thyroid hormones. And when that receptor is under attack, that production goes unchecked, and then we get excessive amounts of thyroid hormones in the body. And so a lot of the same things that we need to do for Hashimoto's are going to be done for Graves' disease as well. And in Graves' disease, hypothyroidism is a very kind of like one of those insidious and slow conditions that kind of, all of a sudden you realize that you're more tired, and those are the kind of symptoms, and you have to have
People live with it for a long time before they figure it out.
Yeah.
Like you.
And you also have to have it for a long time before it becomes life-threatening. Like, you can fall into a coma with Graves' disease. Like, it can be really, really serious really fast, where you can actually have heart issues. It can be dangerous. So oftentimes people will need to take some sort of suppressing medications, or I know some of my colleagues in the natural space will use targeted, really strong herbs to suppress thyroid function.
Mm-hmm.
They try to figure out the underlying causes, because it's very important to not have this excess thyroid hormone, because that can be very dangerous. And, generally doctors in the US, the first thing they'll say is like, let's either take out your thyroid or do radioactive iodine. But, a lot of people will find that just by taking medications for a certain amount of time, that can actually put them into remission. And of course, when they do these other things that we talk about from a functional medicine perspective, they have a higher chance of getting into remission than just I think the standard medication rate is somewhere between 10 to 20% without any of the functional medicine stuff. But doctors are oftentimes quick to say, in the US, just take out the thyroid, where in Europe, likely to say, okay, let's try you on meds first and see if you can get into remission.
I've seen that, many times. People I know who, the little thyroid problem, and all of a sudden it's like the doctors took their thyroid out, and it's like, oh man, come on. They didn't give them a chance to try to get well, to try to heal, and it's frustrating. And I know just doing this interview, hopefully more people will understand that they have options, that they can heal, that it's possible, they can get well. They don't have to rush to have an organ removed.
Yeah, absolutely. And there's actually a new study that's coming out, and they're trying to treat Hashimoto's as a surgical disease, where they'll recommend just removing the thyroid gland in Hashimoto's. And I'm like, because it reduces thyroid antibodies. I'm like, there's so many other ways to reduce thyroid antibodies. They have like a document with 40 different ways to reduce thyroid antibodies. And all those ways don't involve removing your thyroid gland. And so it's like,
God,
we have these organs for a reason.
Yeah. I get headaches sometimes. Maybe I should get my brain removed.
Yeah.
It'll stop the headaches. Actually, I don't. That was just an example. But yeah, that's so frustrating. But hey, the more you and I are talking about these things, the more the public will be aware. And I think that's what's going to change the medical industry, and the way doctors treat their patients is really going to be changed from the ground up, from the bottom up. When patients are asking for better treatment, for more integrative and functional medicine, because they hear people like us talking about, hey, your diet matters, like nutrition matters, the way you're living your life matters, your stress matters. And these are all things you can change that don't require a lifetime of living without an organ or drug dependence. Okay, I think this is going to be my last question. Radioactive iodine seems like a really bad thing. What is your opinion of that?
That's going to be one of the recommendations for people with Graves' disease. And one of the things that it can do, actually, can exacerbate the Graves' eye disease that we talked about, where the eyes begin to protrude. It's something that destroys the thyroid gland. And so I would say, if you have a chance, when you destroy the thyroid gland, then you're basically going to have to take thyroid medications for the rest of your life.
Or take it out.
Right, or take it out. If you take out the thyroid gland, that also happens as well.
Take the medications for life.
Yeah, and there's other options too. So before before the radioactive iodine, consider doing medications and definitely working with a functional medicine doctor to try to address the root causes. There's also there's one immune modulating medication, low dose naltrexone, that also may be helpful for modulating the immune system and can get some people with Graves into remission. So there's so many different options for you out there that, not to say that nobody should ever get their thyroid gland removed, but, like look at all of these different options you have in front of you. And there's so many different things you can do to get yourself better and into remission and healed without having to take an organ out. One of the big things that can be triggering both Graves and Hashimoto's is an infection known as H. pylori.
Yeah.
So some people will find out they have this infection, they'll get treatment for it, and their autoimmunity goes into remission. And sometimes it's as easy as that, where you just remove a food or you remove an infection and you can get better without having to live without an organ or having your thyroid gland damaged by radioactive iodine. Because, that's what it is. It's basically renders your thyroid gland not functioning.
They're like, your thyroid gland is not working right, so we're just going to try to kill it, right, and poison it, and maybe it will not be as bad or something, right?
Right.
Not work as it's working badly. Maybe it'll work less badly if we poison it.
Yeah, and I think when, in 100 or 200 years from now, we'll look back at things like that when medicine's more advanced and we'll say like, wow, we were really doing these things to people. Like, when you think about people getting lobotomies back in the day, like I think we'll be looking at things like that the same way.
Well, I think that's a great place to end on. And the key word here is options. Like just people need to know they have options. If you don't like the option that your doctor has given you, you don't have to accept it. You can get a second and third opinion. You can read and research and learn things on your own without a doctor, and then come back and find one that will work with you. And obviously you're a practitioner, and there's many others that are of the same mindset as you that are trying to help people get to the root cause. So I want to remind people about your book, a bestseller, a New York Times bestseller, Hashimoto's Thyroiditis, The Root Cause. Is that the title? I mean, I know it's a longer title, but
it's like the world's longest title.
Lifestyle Interventions for Finding and Treating the Root Cause. Yeah. See, I got it. And I'll link to your book. And where can people find you online?
They can find me on thyroidpharmacist.com, and I actually have information for them if they wanted to go to thyroidpharmacist.com gift. I have a nutrient depletions and digestion chapter that talks about some of the most common nutrient depletions and some recipes to get them started. And I'm also on Facebook under Dr. Izabella Wentz, thyroid pharmacist. So I like to interact with people on a daily basis there. So
yeah, and big following on Facebook, right? 100,000, 150,000. What is it?
We have close to 200.
Yeah, wow.
Rebels, so people who are really interested in finding the root cause of their conditions.
I love it.
Very excited about that.
Yeah, you're doing great work. It's fantastic. Okay, well, great. I'll put links to all this stuff in the show notes, everybody. So if you're listening on iTunes, you can go to chrisbeatcancer.com/podcast for the show notes. If you're watching on YouTube, there will be a link right below the video. So Dr. Izabella Wentz, thank you so much.
Thank you so much, Chris. It's been so great chatting here with you.
Okay, talk soon.
Talk to you soon.
Bye-bye.